do you find discussing hepatitis B with patients?
Well, historically, it's always been a bit of a taboo subject, quite hard to, talk about in a consultation. People tend to think that it's just a sexually transmitted disease, or perhaps people, injecting drug users. But what people don't realise that it's also contracted perhaps through tattooing, from blood transfusions, renal dialysis, and also people requiring dental treatment or hospitalisation.
And are there any patients with whom you find it quite difficult to approach the subject?
I always find it more difficult with younger people. Women, I suppose it's a bit easier because you might see them opportunistically and mention things, perhaps during a family planning consultation.
So for these more difficult patients, how do you address the topic?
I think ways to approach this is by doing a risk assessment. That way you can go through the routes of exposure and the possible risks with the patient without them having to identify which group they might find themselves in.